Hello, everyone. I'm Marcia Mott, the Health Promotions Coordinator for UF Health. Welcome to UF Health Wellness University webinar today. Our topic today is kidney donation, and we have two incredible speakers for you. Our first speaker is Dr. Ashraf El-Hinnawi. He is the Associate Director of the UF Health Kidney and Pancreas Transplant Program, and the Clinical Associate Professor in the Division of Transplantation and Hepatobiliary Surgery at the University of Florida College of Medicine. He also serves as the director of the UF Health Living Donor Kidney Transplant Program. He completed a Bachelor of Medicine, Surgery, as well as his general surgical residency at Jordan University. He also completed 2 fellowships in abdominal organ transplantation at Jackson Memorial Hospital in Miami and The Ohio State University. Prior to joining UF Health, he worked at The Ohio State University as the director of the Transplant Surgery Fellowship Program and the Associate Program Director of the General Surgical Residency Program. He's been the principal investigator in a number of clinical studies and has multiple peer-reviewed publications in the national and international journals. Our second speaker today is Sandra Demasters-Reynolds. Sandy earned her bachelor's degree in nursing from Austin Peay State University and her master's degree from Grand Canyon University. She has worked with transplant recipients for over 30 years and has served as the manager of the UF Health Kidney and Pancreas Transplant and Living Donor programs for 10 years. In January 2020, just before COVID reached the US, Sandy saved the life of a stranger and ultimately her brother-in-law by becoming a paired kidney donor. If you have questions for either of our speakers today, you can submit your questions at any time using the Q&A tab at the bottom of your screen. At the end of the presentation, I'll ask questions that you guys submitted. Dr. El-Hinnawi, I'm going to turn over to you now. Thank you so much for joining us.
Hi, good afternoon. Are you able to see my screen well and hear me well?
Yeah, everything looks great.
All right. I'm Ashraf El-Hinnawi. I'm a transplant surgeon at UF. Thank you, Marcia, for the introduction. We're here today to discuss the question about could you save a life with living kidney donation? I'll start with some facts about waitlist and patient waiting for kidneys. As of today, around 90,000 patients are waiting for a kidney transplant. Since the January of this year, around 30,000 patients were added to the waitlist. Around 19,000 kidney transplants were performed. Almost 4,500 from them come from living donors. So obviously there is discrepancy between supply of kidneys and the need for kidneys. And that actually, unfortunately, resulted in death of 3,200 patients on the while waiting for a kidney transplant. What is living kidney donation? So a living donor is a person wanting to donate a kidney to someone in need for transplant. And they are really agreeing on having surgery that they don't need, just to help another individual. It offers another choice for transplant candidates, and it extends the supply of organs. There are multiple advantages of living donor kidney transplant. One important advantage is that we decrease the number of patients waiting for a kidney transplant, and we free up organs for other patients on the wait list in need for a kidney transplant. The major advantage is that the recipient doesn't have to wait as long for a transplant, and they can get their transplant before they get on dialysis or before they become too sick to survive a kidney transplant, or God forbid, before they die on the wait list. Another major advantage is the quality of the kidney, which is much better from living donor compared to a deceased donor. It almost always works immediately and usually lasts longer. And this is shown in the tables in the presentation. The graft survivor and patient survivor, when compared to deceased donor. In living donors, it's significantly better. Another advantage is the emotional satisfaction that donors and recipients feel when they are involved in such a life-sharing experience. Usually the donors are family members or friends, but there are individuals who choose to donate a kidney without knowing at the time of their evaluation who will receive that kidney. And this is an undirected kidney donation, and those generous donors, also known as Good Samaritan or altruistic donors. Usually there is a good match between the recipient and the donor who's willing to donate the kidney. But in certain circumstances, the donor and recipient are incompatible. And by exchanging two incompatible pairs, we can sometimes make the whole exchange compatible, and we can change an impossible transplant to a possible one. The only minor difference in that from donor standpoint is that sometimes those exchanges can be through a long chain of up to 10 or 20, or even like if it's across the country, it could be much more than that. And usually the donor will need probably multiple blood testing and to make sure they are good match. And on certain occasions, like if any of this patients on that chain for any reason get delayed or something, then it can affect the whole chain. But other than that, it's similar to direct donation. So which kidney to donate? Our goal from this whole process, the main focus is to make sure that the donor does not get any harm. And one of these goals is to try to keep the better kidney for the donor. So we look at size, function, and abnormalities. We always keep the bigger kidney with higher function for the donor. If there is any small benign abnormalities in one of the kidneys, like a small benign cyst or small stone, then this is the kidney that will be donated. If both kidneys are similar in size and function without any abnormalities, then we look at the anatomy and we choose the kidney that's easier for transplant based on the complexity of the anatomy. There are certain situations where we discourage donation, or we would consider certain conditions as contraindications. Age less than 18 or less than 21 for altruistic donors. And this is mainly just to make sure that the decision is made maturely and in a well-informed and voluntary way. Active cancer or infection, obviously contraindication for any surgery or for surgery and kidney donation. Diabetes and uncontrolled hypertension. These are conditions that can be associated with high risk of perioperative morbidity and complications, and can also affect kidney function on short and long term. So these are contraindications to donate a kidney. Obesity defined by body mass index, which is the weight in kilos over the height in meters square. If it's more than 35, then this is also associated with higher perioperative complications, and it can also affect kidney function. So we discourage, or we decline usually here, BMI more than 35. We ask them to lose weight if possible. And until then, we don't recommend donation. There are certain situations where there's some controversy or some questions that come to us, like asymptomatic stones in the kidney. And we usually look at it as small incidental renal stones. They have low rate of stone events. And the current recommendation is to allowing such donors to donate as long as they are left with a stone-free kidney and that their medical workup doesn't show any higher risk of stone formation in the future. Blood in the urine is can be a benign thing, but in order to exclude any kidney disease, potential donors may have to go through an extensive workup, multiple imaging, or even kidney biopsy before they are cleared for donation. Polycystic kidney disease is a disease that runs in families, and it's usually presented by kidneys replaced by multiple enlarging cysts that eventually replace all kidney parenchyma and end up in renal failure. And usually potential donors whose parents or siblings have polycystic kidney disease have a 50% chance of having polycystic kidney disease themselves. But usually by the age of 30, this disease will declare itself. So at the age of 30 or above, a simple imaging study, like an ultrasound, if it shows less than 3 cysts in a kidney, then that excludes the disease and donation can be done safely. If age is less than 30, then or the imaging are equivocal, then genetic testing can be used to rule out the disease and proceed with donation. This is a very common question we get about what is the risk of renal failure after kidney donation. So the relative risk of end-stage renal disease in donors is less than the general population. But usually donors are very healthy people. So when we compare kidney donors to healthy non-donors, there is 8 to 11 times increased risk of end-stage renal disease. But the message that we send is that although there is an increased risk of end-stage renal disease after kidney donation, the absolute risk is still very low and less than 0.5% at 15 years and less than 0.9% for lifetime risk compared to 3.2% for the general population. And there is some online risk calculators that can be used to help assess this risk and help guide the informed consent with the donor. Around 60% of kidney living donors are females, and most of them are in the childbearing age. There is no current data that suggests that donation impacts the ability to conceive. The risk of stillbirth, neonatal death, or maternal death in post-donation pregnancies is very low. The only increased risk is gestational hypertension or preeclampsia among women with pregnancies after donation compared with pregnancies before donation. So how does the process work? The process starts by a patient coming to a transplant center who's being evaluated for a kidney transplant. At that time, we encourage this potential recipient to look for a living donor for the advantages that we talked about earlier. And we encourage them to look for the donor by sharing their story. Sharing the story is the most important part of trying to find the donor. You can talk to friends, family, large group gatherings in religious groups or social gatherings. Social media is very open nowadays and improve the exposure of that to many people. I've heard story about billboards, advertisements, and on the car, like on the back window of the car, they can write a message, and these things work multiple times. Once a donor is available or somebody is willing to donate a kidney, then they submit an application to the transplant program. And then once we receive an application, the donor coordinator will contact the potential donor. And if there is no major contraindication for donation, then we inform the donor that once the recipient is approved, we can start the evaluation process of the donor. The evaluation consists of multiple clinic visits and coordinator visits. The transplant nephrologist will see the potential donor to make sure from a medical standpoint that the kidney function is acceptable for kidney donation. The transplant surgeon will make sure that the surgery can be safely done and help choose with the donor which kidney to donate. The transplant coordinator have a crucial role to coordinate the process and follow up with the donor and the testing. Psychosocial evaluation is very important also to make sure that the donor is aware and of all the circumstances around donation and is willing to do this voluntary. The living donor advocate is a very important part of the process. The advocate is usually on the side of the donor, make sure the donor understand all the details about donation and what are the risks associated with that, and make sure that the donor make a voluntary informed decision. Even if the donor wants to walk away, the living donor advocate will help do that in the correct way. Regarding testing, we get several blood tests, including general tests for preparation for surgery, blood group, cross-match with the recipient to make sure there is a good match, some tests to evaluate the kidney function, and the infectious workup to make sure there is no transmission of disease between donor and recipient. We get urine testing to check for urine infection and evaluate simple functional tests for the kidney. A chest X-ray and an EKG are done as part of preparation for surgery. Then we get a CT scan of the kidney, and this will help us look at the size, the anatomy of the kidney, and detect if there is any abnormalities in the kidney to help us choose which kidney we're gonna donate. We also do a 24-hour urine collection study or a nuclear medicine study, and this is to assess the function of the kidney and evaluate each kidney functional percentage. And we ask all donors to provide routine cancer screens appropriate for their age. Usually the evaluation process and testing process takes around 2 weeks. And once all that is done and everything is ready to go, we plan for the surgery. And we make appointment for that surgery. We discuss with the potential donor which kidney we decide to use based on the criteria we mentioned earlier. 1 or 2 days before surgery, both donor and recipient will be evaluated in the clinic again for an update clinical visit to make sure everything's still the same and they still in good physical shape to go for surgery, and make sure the donor is still voluntarily willing to proceed. The day of surgery, we start with the donor operation first, and there is multiple approaches to donor surgery. One is an open surgery with a big incision that's almost absolute right now. There is a hand-assisted laparoscopic approach, which we do here at UF. And then there is pure laparoscopic or robotic approach, which we are hopefully in the process of introducing our robotic surgery program to the transplant division. This picture shows the incisions we use. We make a small incision in the lower part of the midline of the abdomen, and this is where the hand is introduced to assist in the surgery and to take the kidney out. And then 2 small 1 centimeter incisions in the left upper side of the abdomen if we decide to take the left kidney. The surgery usually lasts 1 to 2 hours. Just before surgery, we put a Foley catheter to control the urine output. And then usually after surgery, the first day, the Foley catheter is out. The donor is encouraged to eat and drink and ambulate. Usually donors stay in the hospital for a day or 2. On rare occasions, they can stay longer for pain management. And the follow-up, usually after they go home, we see them in the clinic after 2 weeks. And then at 6 months, we check on them by a physical examination, including blood pressure management and kidney function test labs. And then they follow up with their PCP on an annual basis. What are the potential complications of laparoscopic donor nephrectomy? This surgery is considered safe and associated with acceptable complication rate. The main complaints or early complications include pain and GI discomfort, but these are well managed by medications, and usually by the time the donor go home, these symptoms disappear. There is always risk of infection in site of operation. There is risk of incisional hernia at the site of any of those incisions. The incidence of readmission is very low, less than 5%, and it's usually related to pain or GI discomfort, or on rare occasions for need of reoperation if there is a small bowel obstruction or a hernia, incisional hernia that needs to be repaired. On very, very extreme, rare situations, we have to convert from laparoscopic to an open approach or give blood transfusion. Those are only done if it's going to be something we need to do to save the life of the donor or save the kidney. The medical expenses associated with living donor evaluation and surgery are covered either by the recipient insurance or in certain circumstances by the transplant center. There are some non-profit sources for financial assistance for living donors that can help in like transportation, hotel stays if needed, or childcare expenses. And those are 2 links that further information can be found there about that. At UF, we have a long history in kidney transplant. Actually, the first kidney transplant in the state of Florida was done here in 1966. Since then, over 5,000 kidney transplants were completed. 1,285 of them were from living donor transplants. Over the last couple of years, our transplant program has been growing tremendously under the leadership of Dr. Vidusky, and he's building a great, motivated, passionate team around him to help in the mission of saving as many lives as possible and helping as many people as possible. We have a big group of coordinators that really put all the effort needed to make the experience of patients and donors very easy and without any obstacles. We have excellent group of nephrologists and transplant surgeons who really put all the effort to do an excellent job and help as many people as possible with excellent outcomes. If there is any questions or any information needed, our contact information is available on this slide. I would like to thank you all for your time and for listening to us. And if there is any questions, we'll be happy to answer. I'll let Sandy now talk to you about her experience.
Well, hello, everyone. My name is Sandra Demasters-Reynolds, and my sister married a gentleman back in 1978, and we knew that he had some sort of kidney disease, but we didn't really know what was going on. Several years later, down the line, found out it was polycystic kidney disease, and at the age of about 65, he started on dialysis. He had 3 donors evaluated before I was evaluated, and they were both turned down, or all 3 of them were turned down for various reasons. And I thought, well, I work in kidney transplant. I've known he's going to need a kidney for a long time, so why don't I get evaluated? And I did. And I knew going in, I was not going to be a blood match for my brother-in-law. He had a different blood type than I did, and we were not compatible. So going into it, I knew that my kidney would not be going to him, but would be going to somebody else. So the evaluation was completed. And then for a kidney pair donation, you may have to wait till they can find someone to match for you. But we only waited from March until December till a match was found for us. And on January 2nd of 2020, I donated my kidney to him or to someone. And during that process, 4 people actually benefited. 2 people got transplants and were taken off the waiting list, and they both got a live donor kidney transplant, which opens up the list for 2 more people to be able to get a kidney transplant because 2 people were removed. So in total, I feel like 4 people really benefited from this living donation. Since then, I've had no complications. I've done my routine follow-up. Everything has been fine. I've told my brother-in-law if I had to do it again, I would. It was a very good experience. And you do get the emotional benefit from it, just knowing that you have helped someone else. And then I do get to share my story a lot with patients that come through that think about being a donor. I like to talk to them, ask them if they have questions that I can answer for them, or just share my experience. So I think it's very worthwhile. I encourage you to think about it if you are all interested, because you can definitely help save lives by giving a kidney to someone else in need. So we are here for your questions.
Okay. Thank you for sharing your story so much, Sandy. It's a great story. I remember I read an article about it and thought how amazing it was that you were able to do that. And also, going into that, already having being in that field for so long, it really, I think, is a great testament to how beneficial this can be and how these selfless acts of kindness can really affect so many people. Like you said, I didn't think about it from the perspective of, how it touched 4 people's lives. So
Right.
we had a couple questions that were submitted, but please feel free to submit any other questions if you have them. One of them is going to be, what is the first step to get started in the process if you or a loved one is interested in living kidney donation?
Contact our program. We can send you the booklet that describes live kidney donation. And it also has a little application to fill out and send back in to us. And then when that is received, it's reviewed by our team and you're contacted right away to start scheduling an evaluation or just to clarify if we have any questions on the application.
Okay, thank you for that. And then I'll share that number when you in the follow-up messaging and things like that come out of this, in case anybody wants to know that, as well as the website. From the time someone requests or thinks they might be interested in that and maybe fills that out, what is that time process like for all the testing and evaluations of both the donor and the recipient? What is there an average for that?
Well, the recipient is already listed, so there shouldn't be a whole lot of additional testing, just maybe some blood testing to make sure they're compatible with this donor. For the donor, the evaluation is either 2 or 3 days, depending on which testing we have to do. And then if everything is good, we present them at our medical review board, and then we can schedule the surgery. So usually within a month of evaluation or turning in the application, if everything goes well, then we can schedule a surgery.
Oh, wow. I thought you were going to say, well, it's like 9 months.
No.
That's really fast and but interesting. And I think in preparing for this talk, one of the things I found very interesting is that one of the benefits also of living kidney is you can kind of plan for it instead of it's Tuesday at 4 o'clock and you get a call that now you're maybe going to be able to get, a donor kidney from a person who's passed away. So that's a really nice.
It makes it very nice because you're not going through that stress of getting that phone call in the middle of the night, having to drop everything and come in. It's a planned procedure. It goes on during the day. Your surgeon has slept all night because he knows he's operating the next day. So it just makes it a much smoother process for the donor and the recipient.
Okay. And then another question that was submitted is, does the donor, the person that's preparing, obviously they're going through evaluations, but do they have to adjust their diet afterwards? Are there things they can't do afterwards or that change for their life other than just being a little more health conscious maybe?
We ask them to just follow a regular heart healthy diet. It doesn't have to be any different than probably what they normally were eating beforehand. As far as lifestyle changes, all I do is try to drink more water. That's about the only thing I've done to change my life.
Okay, that's good. And then another question is, I know you kind of talked about this in the presentation a little bit, but if a person, did donate their kidney, have there been any studies that show that how it maybe dramatically impacts how long they live in their life? Does it affect that at all?
No, like from life expectancy standpoint, no, it doesn't change. It just, obviously, when you take one of the kidneys out, then you are by default taking part of the kidney function. So it increased the risk of kidney dysfunction on long term, but usually that incidence is extremely low and it doesn't really impact their life expectancy.
And we actually find that donors might live a longer life because we are taking the healthiest of the healthy because we don't want to hurt someone. So we want to make sure they're going to be able to tolerate the procedure, tolerate having one kidney. So if they're that healthy, they might just live a very long life.
Wow. Okay. Is there a maximum age for a donor? Is there a cutoff maybe?
So age, we don't put a maximum age when we talk about this, but obviously the testing that we do for kidney function, make sure that the donor has an adequate kidney function, even if they donate one of the kidneys. That kidney function usually get less with age. The highest age donor I've been involved in is 65. And it went smooth and everything is okay, but it needs to be, the donor needs to be in very good shape and the kidney function needs to be adequate to split in half with another person.
Yeah.
Because as we age, our organs age also. So we want to make sure we're going to leave the donor with enough kidney function to support them for the rest of their life.
Okay. Another question that came in is how long does the surgery last for the donor removal? And then how long does it take to go implant it in the person who's receiving it?
So by the time the donor comes to the operating room, there's around 30 minutes for anesthesia, for positioning. Then the surgery will start. Usually the operation time is 1 to 2 hours. It could be more or less depending on, once the donor surgeon see the kidney looks good and decide that it's good to proceed with the recipient surgeon will start. Once the recipient surgeon is ready, then the kidney can come out. So we always try to make it as close as possible that when the kidney is ready to come out, the recipient surgeon is ready. Sometimes there is small gaps in between. But I would say donor operation, 30 minutes preparation, 1 to 2 hours surgery time, another 30 minutes to wake up and get out of the operating room.
Wow.
Recipient surgeon is probably 30 minutes to an hour preparation with anesthesia, positioning, and all that. And then maybe another couple of hours of transplant operation time, and another 30 minutes to wake up and get out of the room.
And then you go to the recovery room. It's very rare that anyone would need to go to the intensive care unit after a kidney transplant or kidney donation. So you just go to the regular floor after you recover in the recovery room, and then your family can visit with you there.
Wow. Okay, that's great. So someone had a great question, I think, and they said, why are so many kidneys needed? Do they fail more because of genetics or lifestyle? They're just curious.
Well, there is multiple diseases that can affect the kidney and result in end-stage renal disease. And there is the only replacement for kidney function, unfortunately, is dialysis now. And if we get kidney transplant to replace dialysis, that's our goal, that's our mission, to try and get as many people off dialysis and do transplant. The diseases there's wide variety of diseases, and some of them are very common, like diabetes, hypertension. So there is many people who are in need for transplant. Unfortunately, the organ supply is less than the need. And our goal is to try to encourage more awareness about being a donor, either a living donor or a deceased donor by, consenting to being an organ donor.
All right. I don't have any more questions. Anything else you want to add at the last minute?
I just want to say I was 60, well, actually I was 59 and 364 days when I entered the hospital to donate my kidney, and I turned 60 while I was in the hospital. So I'm not a young donor, and I feel I've done very well. And I try to encourage people to share their story, because that's the biggest thing. If someone needs a kidney, is to be able to share their story. And you don't ask for a kidney, you say, this is what I'm dealing with, and this is how things are going to progress for me. And these are things that can help me. You can have friends help you share your story. You can have a champion that goes out there and actually tries to recruit donors for you. There's many different methods of finding live donation to be an option for someone. And definitely the social media has worked. We've seen billboards, we've seen cars wrapped. We have had people on our list that have actually received kidneys from altruistic or Good Samaritan donors. So those are out there too, and just give us a call. We'll let you know if it's going to be a potential for you or not.
Wow, amazing. Actually, I did just get one more question that came in. Can you discuss again the limitations that a donor has after surgery? Can they go back to pretty much everything normal?
Yeah, so what we recommend is that they go home, they live their normal daily activity after they leave the hospital after surgery. We encourage them not to drive or do any heavyweight lifting until they are seen in the clinic in a couple of weeks. And basically that's it. And then they can go back to work as soon as 2 weeks, or and then eat normal, live normal life, just encourage them to be well hydrated, and that's it.
Okay, well, thank you guys. You're both inspiring stories from both of you and messages from both of you. So I thank you so much for taking time out of your busy day today to share your story and the gift that you give people in this hospital. And I wish everybody to have a great day. Thank you so much.
Thank you.
Thank you.